We're back with Dr. Jason Ryan, cardiologist at UConn Health Center in Farmington. He is also chairman of the Communities of Care Education Committee. Thank you so much for being here.
Thank you.
How important is communication in the Communities of Care program?
So, first of all, I think it's important to understand why we work here at Qualidigm so hard on communities of care. We know that 1 in every 5 elderly patients with a heart condition who's admitted to the hospital will go home only to come back within 30 days. And we think that's unacceptable, and we know from our own experience that many of these trips back to the hospital are actually preventable. One thing I see a lot of in the work I do is families who are frustrated because they care for someone who keeps going in and out of the hospital very suddenly, and they feel like this is just part of the disease process. But the reality is it's not part of the disease process. It's got to do with how well we take care of patients in our communities, and with high quality care that's coordinated between doctors, nurses, and nursing homes, people go into the hospital far less, and we can prevent a lot of these hospitalizations.
Well, tell me more about the Teach Back method.
So Teach Back is a way we try to educate our patients about their disease process. So patients need to know to take their medications with specifically for heart failure, like we're talking about today. They need to know to avoid eating salt and to weigh themselves every day. And the patients that do these things right, they don't come into the hospital. But educating people is harder than it sounds. When they're in the hospital, they're often sick. They don't feel well. They may be taking narcotics or something else that clouds their memory. So we need ways to get this information across to them. So Teach Back is a way where we ask them to say back to us the information we've just conveyed. Usually I ask them to tell it to me as they would to their wife or son or daughter when they get home. And the patients that are able to say it back to me retain the information much better and are much more likely to follow our instructions when they get home.
Very good. Dr. Ryan, thank you for joining us.
Thank you.
And we'll be back.